Great. Well, thank you so much, Jesse, for taking the time to meet with our students today. There may be another few that trickle in over the next few minutes, but we really appreciate you carving out time on your very busy schedule to tell us about the pre-health clinical post-baccalaureate program in Maine that you and I have spoken about. And so I'll just turn things over to you and let you talk about it.
Yeah, absolutely. Yeah, thank you for the opportunity to chat. Hey everyone, my name's Jesse Billingham. I'm a program manager at the Rue Institute in Portland, Maine. The Rue Institute is one of the global campuses of Northeastern University. And it's a little unique in that a lot of the academic offerings are focused on graduate level education and learning, but there's a whole other sort of arm to the Institute that is really focused on partnerships within the state of Maine, workforce development, entrepreneurship, and sort of it's in that area that I sit and where this program sits. So right now I'm managing a 2-year pilot program that we're calling a healthcare gap year program within the state. And the way that it works is we have a network of healthcare partners. These are range from large level 1 trauma center hospitals all the way down to like small federally qualified healthcare centers and free clinics in rural parts of the state. And that network of partners allows us to place prospective participants in really interesting entry-level roles throughout the state of Maine. So let me share my screen here real quick, and I'll just show a few slides. Oh. Aisling, are you able to enable host sharing by chance, or guest sharing? Awesome. All right, can folks see a slide? Okay, awesome. Got 2 screens working. So our gap year program, as I mentioned, is the benchmark of it is really this network of healthcare partners, of which you can see several of them listed on the right side of the screen there. The program itself is really focused on 2 major things. One, it's providing a direct patient care experience for aspiring healthcare providers who are recent college graduates, such as yourselves, to really get on the ground training and education while they work and get patient care hours. The second piece of it is by doing that, we are also helping our healthcare partners fill critical vacancies in entry-level patient care roles throughout the state. And as I'm sure you're aware, workforce is a challenge in every industry. Healthcare is not immune to that, and certainly Maine is not immune to that as a state. So this partnership has been really fruitful for us, where we're essentially recruiting on behalf of our healthcare partners and providing additional support services to those participants who are hired on by our partners during a 12-month period. So the program itself for a participant would be 12 months of full-time employment with a healthcare partner of ours. Right now, we have 23 folks in the program, and they are employed in a variety of different roles. This is a non-exhaustive list that you see here on the slide. Many folks are working as phlebotomists. Many are working as medical assistants, emergency department technicians. We have 1 person doing dental work up in a rural clinic along the coast of Maine. One really important point here is that no certification is required upon entering the program. So that's one question I get a lot from potential participants is, oh, I'm really interested in this, but I don't have a medical assistant certification. I'm not trained as a phlebotomist. Our healthcare network partners have developed in-house training programs just for that reason. So I don't think any of our 23 participants to date had a certificate or training prior in the role that they're currently in. So that's on-the-job training that you would be able to receive through this program, which is really great. Outside of the job itself, which would be the primary responsibility of all the participants, we at the Rue Institute in Northeastern are able to provide a $500 a month housing stipend to help assist with folks. We call it a housing stipend because we recognize that's one of the biggest challenges folks are facing right now, but we don't monitor that too closely. So if there's another need that you have outside of housing that you want to use that money for, you are able to. It's a check that's cut directly from Northeastern to participants, completely separate of your normal salary or pay rate and whatever benefits that you'd be receiving through your employment piece of it. Outside of the housing stipend, we do our best to provide additional wraparound services including career development and networking between our participants, but also with our network of partners, both healthcare partners, but also University of New England and University of Southern Maine, two institutes here in the greater Portland area that have advanced degrees in a variety of different healthcare trainings there. We also have staff at the RU who are really sort of embedded in rural health within the state. And so we do our best to connect participants with all sorts of happenings throughout the state of Maine, whether it relates to direct patient care or rural health opportunities. Some of the things that we've been able to set up for folks this past year are healthcare hackathon, like a healthcare startup where groups come together to try and innovate interesting solutions to healthcare problems that are being faced in the state of Maine. We offered a wilderness first aid weekend training for all of our participants as well. And it just kind of like runs a wide range of opportunities that we kind of throw at folks. I will say, though, that because the job itself, the employment is the main priority and focus, the list of opportunities that we provide on a weekly or every 2-week basis is sort of a la carte. So folks are welcome to opt into any of them, but there's no requirement that you do. We wanted to keep that barrier pretty low and have folks really focus on getting direct patient care and getting those hours in with our partners. Next slide. So the process itself as to joining the program, folks submit an interest form. And we review that, reach back out and have an initial conversation to sort of describe the program in a bit more detail. You are kind of getting some of that information during this call right now, which is great. If there's interest, then we'll set up a follow-up call where we receive an updated resume from potential participants and really dive into the specifics of our healthcare network, go over where they are geographically in the state, and also what types of roles might be available, and hopefully identify 1 or 2 of our partners that are of interest to a prospective participant. Then we do the facilitation piece on our end, and we connect you directly to our healthcare partners that you've identified. And then we take a step back at that point, and we let you have a more formal conversation with those folks to identify a role that might be of interest and what the steps would be to more formally apply to that healthcare organization. If there is an offer made and accepted on your part, then we step back in, get you formally enrolled in the program, make you eligible for that housing stipend and additional services. And then the start date for most folks is typically between May and August. That's when we onboarded folks this past year, understanding that most folks are kind of graduating in a May-ish timeframe and might need time to relocate, find housing, things of that nature. And all of our healthcare partners are understanding of that and and know that when they make an offer, maybe in February, that person might not arrive until sometime, early summer. So some of these things I just mentioned, no cost to participants at all. That's surprisingly a question I get a lot of, but there's no financial requirement on your part. And again, there's no certification needed on your part. The roles that folks are taking are existing roles that are eligible for salaries or an hourly wage and whatever benefits, healthcare and others that the partners is able and willing to offer there. And again, our healthcare partners are understanding of when folks are going to be starting, which is typically going to be in a May to August timeframe. So I'll pause there to see if there's any questions. That was kind of a lot of information in a very quick time frame. But in short, what we're really focused on is providing our participants with good entry-level patient care experience to get hours, whether it be for medical school applications, PA school applications, or on the other side of the spectrum, we do have groups of folks who are just interested in healthcare and not sure if it's a step for them yet. And they're taking this opportunity to really dive in and get a sense of what a career in healthcare would look like. So I'll pause there. Any questions?
Could you share the schools that you said you had 23 students enrolled in the program this year? Can you talk about what programs they graduated from?
Yeah, absolutely. So they graduated from a variety of different programs. So a lot of folks do have Maine connections, but we have 7 individuals who are out of state and 4 who are international. They have work authorization in the United States, but their primary citizenship is outside of the country. Many of them are from Bowdoin College, Bates College here in the state of Maine, We have folks from Northeastern University, Amherst College, a variety of like small nonprofits, small liberal arts schools in greater New England, folks who are from Louisiana, from Texas, North Carolina. In terms of what they studied, a lot of it is in biology, bioengineering, pre-med tracks. But we also have folks who focus more on social services, mental health. Some folks came from backgrounds in literature and or economics. So there's a wide range, but I'd say the bulk of it is more in the biological sciences.
Okay. And one other quick question, and then I'm sure the students have questions too, but the research, I noticed research assistance was listed as one of the possible opportunities. Can you describe that?
Yeah, absolutely. So all of the roles that our participants are currently in are patient facing, and that was a kind of a big part of the program. We wanted folks to really get that one-on-one or patient forward experience. The research assistant folks are working with patients, but doing research. So they're not working in a clinical setting in the sense where they're not seeing a patient, taking vital signs, performing procedures or anything along those lines. They're coming in maybe after those things are done or after the primary visit has been completed, and they're getting information from a patient based on their condition, their illness or their injury, or what they came to the clinic for that day for research purposes for the physicians or the researchers that are at that clinic. But they're working one-on-one with those patients, but in a bit of a different role.
I think I have two questions, if that's okay.
Absolutely.
I was wondering if you could dive into a little more detail about the matching process with employers and students. And I was also wondering if there's any way we can get connected with current students that are part of the program right now.
Yeah, absolutely. So the matching process is focused more on, I'd say, you as a potential participant than it is on the healthcare partner, which is why we spend like about 30 minutes just sort of diving into what opportunities are there and making sure that we're connecting our potential participants with a partner that they're already interested in, that they're already a bit familiar with. So that's kind of our number one goal, is to really make sure that fit works really well for folks. And so we start small. So we have 9 healthcare partners right now, and we try and find 1, maybe 2 to start with. And then if that doesn't work out for whatever reason, then we have another conversation and identify another 1 or 2 and sort of make it an iterative process. I will say, of the 23 folks we currently have in the program, I don't think any of them didn't end up at their first choice. So there's a big need out there. And there's a lot of demand, and our partners are eager to hire more folks. Yeah. Your second question about connecting with current participants, yes, I'd say that's absolutely a possibility. We have several participants that have been having very positive experiences and would be interested and willing to chat with folks. If you're interested in that, just maybe follow up with me and I can connect you directly. Yeah.
Thank you. I'd definitely be interested.
Yeah, absolutely. And I think you may have my contact already, but I'll put my email address here in the chat for you.
And Jesse, you and I had talked about the cost of living being lower in Maine, or comparable perhaps to North Carolina. So just because the employers are the ones that are paying the participants in this program versus the Northeastern University per se, I know that the compensation rate will range, but can you give us, like, of the 23 participants this past year, what that range has been, so students know what to expect?
Like hourly rates and such?
Yeah, like, do you have a range of that?
Yeah, so unfortunately at this point I don't. That is because that is an agreement between our participants and the employers, employer-employee. We don't have insights on that right now. I think we're going to get access to that sort of after our current and first cohort will be completed, sort of looking back at what the salaries that they had were. I've spoken with our participants about that and asked them directly how they feel that their salaries are matching their financial needs. And everyone says that that it's okay, that especially with the housing stipend, that they're able to meet their needs, save a little. No one is having or experiencing any hardship financially that we've heard of, for what that's worth. And I know that's kind of vary person to person as to, you know, what those financial needs are and what folks are making. But we are seeing, you know, I'd say overall, we haven't had many participants feel the need to negotiate or feel the need to look elsewhere at different partners or different roles after they've received an offer, an initial offer.
Excellent.
I know that's a little bit of a vague response, and I apologize for that, but we're seeing folks meeting their needs, yeah, with these roles.
One more question. I think a lot of the roles, like phlebotomy, sorry, I'm pronouncing that wrong, but most of them require certifications, but do students get certified during the job, or how does that work with
Yeah, absolutely. So none of our current participants came in with a certification. So basically the first 4 to 6 weeks of employment, depending on what partner you're with and what role you might be in, is sort of on the job training. So specifically for phlebotomy, most of our folks working in that role are with Maine Health. They're the largest healthcare provider in the state of Maine. And they have a great 4-week sort of boot camp for becoming a certified phlebotomist. And our participants are doing that, just went there first, you know, got paid to do it and came out as a certified phlebotomist and went off to the clinics to work. We have other organizations that have developed a really nice in-house training programs for medical assistant. That role itself up here in the state of Maine is a little bit more involved in terms of getting the like a license for the state. So what they've done is they've developed a training which allows folks to work in-house under that title and do maybe 85 to 90% of the role that a licensed medical assistant would do. But it doesn't quite get that licensure level. There is an opportunity to get additional training and then sit for that test. But they're still able to work as a medical assistant in those clinics. And there might be 1 or 2 procedures that they just don't do that a licensed medical assistant would do. But that's been a really, really fruitful and beneficial program that some of our healthcare partners have set up. And we've gotten a lot of good feedback about that.
I have another question too. Would students be able to rotate around, or if they come in and are hired as a phlebotomist, that's what they're going to do for the whole year? Or would they be able to say, do the training for the phlebotomist, do that for 6 months, and then move to a different type of role?
That's a great question. So it would all depend on the healthcare partner. What we don't want to do is put an undue burden on those partners. So if someone makes a commitment for a year to that partner, we'd like them to keep that. We wouldn't like them to, say, move from Maine Health and then 6 months go to Northern Light Health. However, within some of the larger healthcare networks like Maine Health and Northern Light, there are many, many opportunities. And we've had some folks, say, like in phlebotomy specifically, that wanted to switch from inpatient work to outpatient work. And that was fine with us. As long as it is okay, that move within the partner that they started with, and it's okay with the partner, then we're happy with whatever that decision is. We don't wade into those waters too deeply, but we just don't want folks jumping between partners during the year, if that makes sense.
Mm-hmm. Mm-hmm.
Also, for the cohort, once you get in, would you be meeting other members of the cohort? And also, oh wait, actually, sorry, that's my question for now.
Yeah, no, that's great. That's a great question. So yeah, initially, yes, we try and bring everyone together at the beginning of sort of the start of May, basically, as folks are graduating and getting ready and geared up to come up to Maine if they're not here already. But there is a little bit of a challenge with that because they're scattered across many different healthcare partners in different roles, different places geographically within the state, and different working schedules. With that being said, I'd say, you know, with all those opportunities that we send out on like a biweekly basis, I'd say between, you know, around 6 right now, people show up to each of the in-person things that occur. So there are, you know, 6 of 23. So it's a small percentage, but people are kind of picking and choosing what works with their work schedules and things like that. That's across our entire cohort where people are scattered, you know, hours and hours apart, you know, when they're working. Individually with our healthcare partners, yeah, there's much more of an opportunity. So one example is Greater Portland Health. They've done an amazing job developing one of those medical assistant training programs that I was just describing. They have a cohort of 6, and they had them all start at once and go through the training together. And they kind of developed a mini cohort, and they're going to hire 8 folks this next year, which is really fantastic. Similar with Maine Health, we had 4 people go through the phlebotomy program together, and that was really great. We have folks up with Northern Light Health at a hospital in Bangor, Maine, Eastern Maine Medical Center, and they went through trainings together. We have some smaller clinics where there's only one person working out, where they're a little bit more isolated, admittedly. They're in rural parts of the state, doing more specific work, dental work specifically there. And so they don't have as much access to a cohort type feel, but we still open everything to them. And they've taken drives down here to Portland to get connected to some students here at the Rue Institute that aren't in our program, as well as others that are. But it's a little bit more of a challenge for them, admittedly. Yeah.
I remember my second question. What does career advising look like for the program? So would it be like workshops, or would it be one-on-one? I'm currently a pre-med student looking to take a gap year after graduation. So I think I'd really benefit from gaining clinical hours here. I just wanted to see like how it can help me like connect with like network, and also make a step toward the future.
Yeah, absolutely. So sort of twofold. One is through the job itself. Part of our, what I'll call the matching conversation, is we discuss what you're interested in. So if you're interested in going to PA school, it doesn't make a ton of sense for us to try and put you at a clinic that has no PAs working at it, right? So we want to make sure that those connections are made up front on the job side of things, that you have someone to shadow that you're interested in becoming one day, let's say. On the other side of it, we are connected with a variety of our own PAs and physicians that are not necessarily with clinics that we're partnered with, but are really interested in supporting people and having, you know, one-on-one conversations to kind of talk about what their roles have been like. And advise folks that way. So we've been connecting people that way, sort of ad hoc and on a one-on-one and as needed basis there. We also have connections with the state of Maine and their career pathways programs, which admittedly, if you're pre-med already, might be a little bit, you know, you might have already sort of seen some of that information or be understanding of it. But our connections at both the University of New England and University of Southern Maine, who have the academic programs, both in PA school and medical schools, there, and nursing as well. They have been really supportive of connecting with prospective applicants, let's say, but talking through what graduating from a program in Maine might look like, and what the healthcare landscape coming out of that might look like here in the state of Maine. So that's sort of a long-winded way of saying we try and work one-on-one specifically with folks to identify what their needs and questions are, and then find the right answer to them or for them. Good question.
Any other questions, Anne?
I think I'm good for now. I'll definitely reach out with for connecting with current students, if that's okay.
Absolutely. Yeah, please do.
Yeah. How far along are you in the application process? I know, Jesse, I was originally envisioning doing this info session in January or February, and you're like, no, it'll be all done by then. So can you help advise us on a timeline and where you are in the process?
Yeah, absolutely. So as I mentioned, this is a 2-year pilot program. And so year 1, we've already recruited for, that's our 23 that already happened. And so we took a little bit of a longer time. We're finding that where we are today, basically, let's call it the beginning of December already, or say December 1st, last year, we hadn't even like opened up the interest form yet or anything like that. As of, you know, let's say December 1st this year, we're going to have almost as many interest forms completed as we did all of last year. And I've already made 12 connections between potential participants and our healthcare partners. So things are moving a lot quicker. Like I said, 23 folks this year. We're hoping to increase that to at least 30 this year based on available funding, maybe even a few more, fingers crossed. I'm not going to say that the 12 folks that we've connected already, they're instant hires, you know, and that those 12 spots are taken already, but we're finding that things are moving a lot quicker. So the sooner that we can connect you and start a conversation with a potential healthcare partner, the better. It is not a commitment that you're making by having that initial conversation, but it's starting the process. And so that once you're on their radar, you know, that can help as more connections are made. You know, you'll kind of be in front of the line, so to speak. there. So yeah, we're based on the interest that we're seeing. I mean, all spots could be filled by February, but we'll keep things open until they're completely full. Yeah.
Mhm.
But earlier the better in terms of just making those initial connections.
Excellent.
Yeah.
Excellent. Thank you. All right. Well, unless Anne, you have another question here, I think we can leave it there for today. I think it's a phenomenal program and what a great idea of the state of Maine to invest and make this possible for students to support the housing stipend and facilitate your arranging the connection between graduating seniors and health facilities that really need their help. So thank you so much for telling us about it. And I will certainly encourage our pre-health students to seriously consider it. I know a few of them are like, Maine, haven't been there. I guess maybe just close out with like, what's it like to live in Maine? What's your pitch on that? That would be helpful for students that have never even thought to live there before.
Maine is beautiful. New England, you get all 4 seasons. I grew up in New Hampshire, so the state just to the west, but I've spent time living in Colorado, in Oregon, and in Washington state. And every time I always wanted to come back to the northern New England area. In Portland here, we're right on the coast. It's beautiful if you've never experienced the Rocky Coast. I know North Carolina has a beautiful coastline as well, but it's a very unique coastline that we have up here in Maine. And we also have the mountains, so we have access to everything. We're a stone's throw from the Boston area for people who want a little bit more action and activity. And we're also really close to Canada for folks who want to get outside the country. It's a beautiful spot with a lot to access while still feeling sort of small and community focused, I'd say. Yeah. Nothing but positive things to say about the state of Maine and my experience here. I've been here for 5 years, and it's the longest I've ever lived anywhere. And I think that's saying something for me, for sure.
Wow. That is. Now, and then last question about, like, let's say students do make their connections. You had mentioned to me that you do put students in contact with each other so that they can potentially arrange housing together and the like, right? So
yeah. Absolutely. Yeah. Once we have our cohort finalized, we'll make sure that everyone has each other's information, and we send out a list of sort of what we call preferred landlords. This is a group of folks who work mostly in the greater Portland area, but a little bit more farther afield as well, who like to rent to Northeastern and RU affiliated folks. There's no guarantee that those are all going to be open, but we at least provide that as an initial contact list for folks to start reaching out to. And we provide what support we can. Housing is, of course, the biggest challenge that everyone is facing, and we're not, unfortunately, sitting on top of a big dormitory or apartment building that we can guarantee that, but we do our best to make every possibility out there available to folks to research.
Excellent. All right. Well, thank you again, Jesse. Thank you, Anne, for participating. I know Mackenzie had to jump, but I'll definitely share out this information and really appreciate it. Thank you again.
Yeah, absolutely. Thank you. Take care.
Thank you.
Take care.